So we had the pleasure this year to attend the American Transplantation Cell Therapy meetings, Tandem 23, and we presented the updated result of the Phase III study. It's a multi-center, open-label, single-arm study about tab-cel, which is an off-cell product, EBV positive CTL, in the treatment of EBV positive post-transplant lymphoproliferative disorders, or PTLD, in the setting of allogeneic transplantation or solid organ transplantation, which I'm going to refer to allo, and I'm going to refer to SOT, for a patient who has failed prior Rituximab-based therapy. So we presented the most updated result of that study. So as just a big quick background, the EBV positive PTLD, once they failed Rituximab-based therapy, their outcome is very poor, in a range of less than 6 month overall survivals once they failed Rituximab-based therapy. So that's why the study was designed for those populations who don't have any approved treatments. The study was designed in 2 cohorts, cohort of allogeneic transplantation and cohort of solid organ transplantation to develop PTLD. Patient will receive an outpatient infusion on day 1, day 8, day 15, followed by 2 weeks of observation. And then they will have restaging scan to assess response. Each dose, it's about 2 million per kilogram of those tab cells. And we enrolled and analyzed by November 2021. That was a cutoff for analysis. We have 43 patients, 14 being in allogeneic PTLD and 29 in SOT PTLD. So a total of 43 patients. And the goal eventually to enroll 66 patients total. So among those patients, majority were predominantly were white. Median age was 48. And they comprise very high-risk PTLD patients. Most of the patient has high or intermediate PTLD adaptive risk score. Patient has 76% has extranodal disease, lymphoma. Most of them has a diffuse large B-cell type lymphoma. Some have lymphoblastic lymphoma as well. And we have, from SOT standpoint, different organ transplants. Most commonly was kidney, but there was kidney, heart, lungs, and liver, and multi-organ transplants. Among those patients, PTLD on average on median was diagnosed about 4 months from the allogeneic transplantations, about 1 year from SOT transplantation. Patient received the treatment on the study in average of 1.2 months for the allogeneic patients. Took longer for patient on SOT to receive the therapy. Took about an average 6.6 months to receive the infusion. Median cycles of required was two cycles, each cycle being 1 month. And when we look at response, which was the exciting to report, overall response was 51.2% overall response, and CR, so complete response among those were 27.9%. And if you look for allogeneic PTLD, the complete response were 42.9%. So pretty high response rates. And interestingly enough, for durable responses, even for patient achieved partial response. So median duration of response was 23 months. And to achieve a response was pretty quick. In median time to response was 1 month. So 1 cycle you achieved the response. So those were response we're excited to report. And we did report the overall survival, which again was, as a whole group, or median overall response was exceeded 14 months, 18.2 months total. And for patients who responded to treatment, they have 1 year overall survivals of 84%. Compared to people who did not respond, they have only 34% 1 year overall survival. So the survivals was different between those two patients who respond or not responded, which is important to report. And lastly, the study was looked for not only the efficacy, but also the safety. So the treatment was very safe. There was no report any death related to the treatment. There was 5 deaths on the study. 3 of them were disease progression. There was only 2 patients who had grade 3 adverse events, and they both were reversible. And to our surprise, there was no reported tumor flare reactions. Tumor flare reactions is something was reported in the past. When those T cells attack the lymphoma, you see the sometimes local expansions. That study was not reported. And interestingly enough, there was no cytokine release syndrome. There was no infusion reactions. There's no infection related to the infusion itself. And there was no organ failures or graft versus host disease associated with the therapy. So it was pretty, so far, pretty safe. And we continue to report, efficacy and safety on this product. But overall, we felt that the results so far, suggest this treatment can be transformative for those patients who has no other options at the moment.